Yesterday, my sister called me and she sounded quite worried. But upon asking, she told me that Mansi, my niece, that is her daughter, is complaining of pain in all the teeth. Suddenly, she wakes up in the morning and she told me that it is paining in all the teeth. Then, on observing, there was a low-grade fever and also she is clenching all her teeth. I was like, yes, I know what are the symptoms like. But then she was worried about, are there any caries or teeth infection that is troubling her daughter? Are you also sometimes confused about your child? In fact, I will tell you that these symptoms are similarly found even in the teenagers and also in the adults. So what are the symptoms of? Why one fine day all the teeth suddenly start paining? Why they just cannot help you eat your food, or there is some bad breath suddenly one fine day? Come, let us find the answer to this question. Hey, hello and a very happy morning. Here you are on my show Monday Mornings with Mansi, and you are on my YouTube channel Dr.mansi Shah. Do not forget to subscribe if you are new to this channel, as every Monday and Thursdays I keep on posting some information and tips related to the oral health, which can help you to have a good and a healthy smile. So, before moving towards our topic, let us find one thing, that what I am going to very specifically speak today is about sinus, or specifically sinus infections, and how is this sinus infection related to your teeth or the jaw pain. So friends, now let me tell you that what exactly is a sinus. Our whole face is having 4 sinuses on our face, which are located in the skull. So these are the 4 sinuses. Now, when this sinus, I'm very specifically going to speak about the maxillary sinus today. That is that sinus which is located right behind your cheeks, here. So this sinus are lined, these are air-filled cavity, and I am going to tell you an interesting fact. Do you know that this sinus helps you to reduce the skull weight, and this sinus are lined by an epithelial cells. So whenever there is an infection or inflammation of this sinus, this linings of the cell in the sinus, then that is known as sinusitis. What are the symptoms of sinusitis? I am very specifically speaking about the maxillary sinus. So this sinus, what are the symptoms? First thing is a low-grade fever or fever. Then there is blockage of nose. There is swelling and redness of the nose and the cheek area. Also, there can be headache, earache and teeth ache. There can be bad breath, and there sometimes can be a mucus discharge. It can be or it cannot be related to how the infection or the inflammation of the sinus has been there. Like if it is due to bacteria, then mainly the mucus discharge, that is the cloudy pus-like discharge from the nose, can be seen. But if it is virus or some chemical related, or because of some overusage of the nasal drops or some drugs, then it cannot sometimes just have any discharge, but yes, there is some inflammation, there is some heaviness here right behind your cheeks, and you can notice it. Okay, so as we have seen the symptoms, as we know what is the sinusitis, how is it related to the toothache? Let us know that. So as you can see it in the picture here, there is the sinus lining which is seen. This sinus lining, if you clearly and closely observed, is very close to this upper jaw, that is upar ka jabda, or the upper teeth. What is this lining and how is it related to the tooth? If you clearly observe that the upper maxillary teeth, these teeth have quite longer roots, especially the posterior ones, starting from the canine. So these long roots directly are placed into the sinus cavity. So if some people have a lower sinus cavity, or some kids have the sinus cavity quite deep down, so immediately if they get some fever or cold, then that sinus gets heavy there is some pressure that is created. If there is mucus that is filled up in the sinus, that becomes more heavy. And the result is, yes, you guessed it right. The result is pain in all the teeth here. Why? Because there is some heavy pressure here. There is something that is irritating and troubling those teeth. So should we relate it to the caries or infection in the tooth? No. Does this infection of the sinus pass down to the teeth? No. It is just that there is an overlapping of this sinus and the teeth, or the teeth are placed in the sinus. So there is that heavy pressure that is felt. Like you can see a bag filled of water. So whenever you fill that bag with the water, obviously it becomes heavy. Similarly, it goes to the sinus here. So it just becomes heavy and the teeth feel the lot of pressure. Now, how do you diagnose that the pain is because of some sinusitis infection and not because of the tooth infection? All you have to do is just bend down. What you have to do is, if you can diagnose it easily. If you bend down and the pressure increases, the pain increases, it is triggering, then yes, it is because of the sinusitis infection. Along with it, you also have to check the other symptoms that are related to it. Now, the main question is, Mansi, how do we get rid of it? So if it is due to bacteria, mainly how you can diagnose it, if it is because of the mucus secretion, the cloudy pus-like secretion, if it is there, then if it is that secretion is happening, then you have to switch to antibiotics. If it is because of some virus or some allergies, then you have to avoid that allergies, and viruses, they usually get treated in 3 to 4 days. Now, there can be one also, it is a diagnostic property also, and it is a treatment also, that you take hot water steam. So, if you take that hot water steam, what happens is the mucus here gets breakdown. It gets a little thinner and it comes out through your nose. The pressure there is relieved. If this is done and you actually feel the relief, then the diagnosis goes as sinusitis, and the other thing is that you're not having any caries or tooth infection. So this is the treatment also, that you keep on taking some hot water steam. Also, for the bad breath, you can use the mouthwash and the warm water plus salt. You have to add 1 spoon in it and then rinse the whole mouth 5 to 6 times daily. Even that will help. As you rinse with some warm water, that will also help you to melt the mucus inside. Then there are mucolytes and decongestants that are available at the drugstores. Even that can help to melt the mucus and treat the sinusitis. So even that can be used. But I would suggest that you first visit an ENT surgeon if the sinusitis infection does not get treated within 3 to 4 days. So my friends, if you have liked this video, do definitely share it with the new parents and also a few adults who can undergo from this infection. Mind it, friends, that it is not only a symptom which is observed in the kids but also in the adults. Many adults do just come and complain to the clinic that, oh my god, one day suddenly today morning I have started feeling the pain everywhere. I cannot control that pain. And you cannot just control clenching your teeth. So that is also one of the major symptoms, that you feel like biting your teeth harder. Why? Because once the teeth gets pushed up or they clench on something, they rest harder on something, they get some pain relief. So if you are having the symptoms or someone around you is having the symptoms, do definitely share this video. Help them know that you don't have to visit a dentist at this time, but you have to visit an ENT surgeon at this time. A dentist can definitely help you by the treatments that I have told you, but an ENT surgeon will be of much better help. Do definitely like, comment, share and subscribe this channel, Dr.mansi Shah. Please do share as much as possible. Help people to know and spread this knowledge of the oral health. Let us all come together and create some happy and beautiful smiles. Stay healthy and stay happy, my friends. Stay fit. Thank you.